Well, COVID continues to be a part of all of our lives as we endure another January surge 4 years after first hearing about the virus. But a new report reveals why some people may not get infected ever. Joining us now is Dr. Abraar Karan, an infectious disease specialist at Stanford. Thanks, Dr. Karan. I just read your article in NPR. So why are some people not getting infected? I know even in their household, the person, if they isolate, we can prevent from getting it. But some people are sharing the same bed as somebody infected, and they're still not getting the virus.
Hey, thanks so much for having me. I think this is a very reasonable question for people in the public to be asking, especially when they're told that this is such a contagious virus. And this gets into the fact that the transmission of diseases is very complicated. Many people get exposed all the time. We get exposed to bacteria, different viruses, different fungi, but to actually get infected is a more involved process that has to do with the person that's actually sick and how much virus they're putting out into the air, for example, with COVID, and the people who are around them and how well their immune system is working, how much of the virus they inhale for how long. So there's multiple different factors. You can imagine in a very crowded setting where you have someone that's really contagious and they're putting out a ton of virus, you're more likely to get sick. Versus if you had someone that wasn't shedding a lot of virus, which many people actually don't shed a ton of virus, you may not infect those around you.
Oh, so like my husband, for example, if he has COVID, which has happened, I didn't get it. Maybe he wasn't shedding a lot of the virus at the time, so that's why I wasn't infected?
Exactly. So that could be for a few reasons. So one reason could be that he has immunity from prior infection, which pretty much most of us, if not all of us, have been infected at some point, whether we know it or not, although there are some rare individuals who haven't, or from vaccination. So getting vaccinated, it sort of primes your immune system. The antibodies that are produced help to ward off the infections. And then there's other components of our immune system, the cellular immune system, and that also gets boosted up from prior infections. So that could happen. You may get exposed to a little bit of virus, but it's not enough to cause you to actually get sick and get infected.
Because I may be more immune and all those things you just listed. I also read that there's a difference that the COVID is not contagious at all times. Let's say somebody gets COVID, they're more contagious at certain times than others?
That's exactly right. So what we know is that early on during the pandemic, when we were first exposed to the virus, people were actually contagious and shedding before they showed any symptoms. And it's almost like our immune system had never seen this before. It pretty much snuck up on us. Now it's more likely that when people start to show symptoms, that's their immune system, their immune response coming into play. And the virus has not necessarily gained a foothold and really gotten to its peak levels. So there are some studies showing that actually a few days after symptoms is when your viral load may be higher, which is different than before. So at different points, your level of contagiousness is varied. It's not the same throughout your infection.
Okay, Dr. Abraar Karan, so interesting. Yeah. We always appreciate your insight from Stanford. Thank you so much for your time this evening.
And it's really interesting
Thank
to
you.
see how it just keeps changing.